Good day, everybody. Good to see you again. Today we want to continue on the topic how to use Vantelin Gel to treat knee pain. And in the previous episode on the treatment of knee pain, we actually spoke on how to treat the anterior knee, the patellar tendon, the quadriceps tendon, the entire quadriceps, including the vastus lateralis, the vastus medialis, the rectus femoris, the vastus intermedius deep inside. We spoke about how to treat the IT band for not only lateral knee pain, but medial knee pain as well. We talked about the joint capsules, lateral and medial joint capsules. We talked about the meniscus, okay, in the knee joint on the lateral side as well as the medial side. We talked about treatment of the meniscus by rubbing the gel in. We want to talk more about treatment of the medial knee. If there's medial knee pain, not only should you treat the IT band, because the IT band could be tugging on the knee, creating medial knee pain, but we also want to treat the medial knee structures, namely the adductors. So you have adductor longus, magnus, and brevis here. We have gracilis. We also have the sartorius that runs up here. Yes, there's this S-shaped muscle you may want to treat, right, for medial knee pain. And then behind, we can treat the biceps femoris, the short head that attaches to the femur, proximal femur, the long head that attaches to the sit bone. You wanna treat the semitendinosus and semimembranosus that also attach to the sit bone if you have posterior knee pain. But for posterior knee pain, very important to treat the popliteus that originates from the lateral condyle of the femur and attaches to the posterior aspect of the tibia. So it goes diagonally across, and this is the muscle that unlocks the knee when your knee is straight, so that you can actually flex it. Very important muscle. So how you do that is you want to rub the gel this way, and similarly for the left side, you want to rub the gel this way. Okay? So diagonally inwards as you move down, diagonally inwards as you move down. So for sciatica, which has often been attributed to the lumbar spine, the lumbar vertebrae impinging on the sciatic nerve, you can of course rub where the lumbar spine is, the lower back, but I want you to know that the sciatic nerve can be impinged not only at the level of the lumbar vertebrae, but also at the deeper external rotators of the hip. So you have deep external rotators here. You have the piriformis. Of course, all this is deep to the gluteus maximus. You have the piriformis. You have the superior gemellus. You have the obturator internus. You have the inferior gemellus, and then you have the quadratus femoris. So all these are external rotators of the hip, except where the hip is flexed to 90 degrees, they become internal rotators, except for the quadratus femoris. So what those external rotators do, they turn the femur outwards, but they can impinge on the sciatic nerve as it goes down the leg. So what do you need to do? You can also massage the gel, if you have sciatica, on that area as well. So not just on the lumbar spine, but also in the area of the butt, okay, deep there. And you can also massage down the middle of the hamstrings where the sciatic nerve runs. So rub the gel in that area as well. So depending on which side you have, that sciatica, you can rub the gel into. Now, that was indeed how to use Vantelin Gel to treat medial knee pain, posterior knee pain, as well as sciatica. So I hope you make use of the gel that uses a very strong diclofenac sodium, an anti-inflammatory drug that is non-steroidal. So it has a minimal of side effects. Avoid using it on children under 12 and on pregnant women. So I hope to see you again in the next video. Thank you for watching.